All right, all welcome. My name is Mike Saramella. I'm the Seafood Safety and Technology Specialist with New York Sea Grant and Cornell Cooperative Extension. I'm also on the Seafood HACCP Alliance Executive Committee and serve as chair for our Community Engagement Work Group. This is the second of our webinar series for this year of educational webinars for our Seafood HACCP community. This particular webinar is going to focus on eliminating and reducing the risk of Vibrio illness. So gearing up for our summer months where we start to see an increase in Vibrio in our local water bodies and potential higher risk for Vibriosis. This is a great resource or tool for trainers to use in the future, educate themselves as well as all those participating in their trainings and their supply chains on Vibrio, how to control it and reduce risk. And we have a great lineup of speakers to go over various aspects of Vibrio and Vibrio control. We'll start with Dr. Cathy Liu from Maryland Sea Grant, who's going to give us a little bit of background and introduction to Vibrio itself. We'll then go into looking at the shellfish control or the state shellfish control authority's role in preventing shellfish-borne illness with Valerie Wunderly of the North Carolina Shellfish Sanitation Branch of the North Carolina Division of Marine Fisheries. We'll then look quickly at handling and cooking raw shellfish, so how to prepare and reduce that risk with Barry Nash with North Carolina Sea Grant. And finally, we'll look at how public health officials respond to foodborne illness complaints with Molly Fullwood. She is an environmental health specialist with Carteret County, North Carolina's Department of Health. All right, so with that, I will pass the screen over to Dr. Cathy Liu to kick us off.
Thank you, Mike. Hello, everyone. Again, my name is Cathy Liu. I am the Seafood Safety and Technology Specialist with the University of Maryland Sea Grant Extension Program. For those who do not know me, you are welcome to scan this barcode for more information about our program. First, I would like to share our program assurance statement as required. In short, University of Maryland is an equal opportunity provider. If you need reasonable accommodation, please let us know. This is another slide that we are required to share. It emphasizes that discrimination is prohibited in any institution who receives federal funding. So, what is Vibrio? Vibrio is a group of salt-tolerant bacteria because they literally occur in seawater or brackish water. Their presence is not a sign of water contamination, especially sewage pollution. The most significant factor for finding them in surface waters is warm temperature. Study has shown that Vibrio are rarely detected until water temperature rise to 15 degrees Celsius or higher. Because of this unique character, Vibrio can be forecasted as weather. There are more than 80 Vibrio species. Most of them are not harmful to us. However, a dozen Vibrios are a human pathogen that can cause human illness. Infection caused by Vibrio cholerae is known as cholera. Vibrio parahemolytics is a leading cause of foodborne vibriosis in the U.S., and eating raw oyster is responsible for most outbreaks. Unlike other Vibrio species, Vibrio vulnifics primarily infect people through open wound contact with salt water or brackish water, but only 10% Vibrio vulnifics infection are caused by eating raw or undercooked shellfish. This is an overview of foodborne illness by major pathogen. We can see that norovirus is responsible for over 58% foodborne illness, followed by Salmonella, Clostridium perfringens, and Campylobacter. Regarding Vibrio infection, it only accounts for about 0.5% of the total illness, which is about 80,000 people get sick and 100 people die each year. This figure shows the economic burdens of foodborne illness. Although the cost caused by Vibrio vulnifax is much smaller than other major pathogens such as Salmonella, Listeria, and etc., the cost is still significant, reach $320 million each year. Vibrio outbreaks usually occur in the warmest months, especially summer, as shown in these slides. In recent years, the U.S. has experienced above average coastal sea surface temperature and widespread heat waves, which has increased the Vibrio populations. The state of Connecticut, New York, and North Carolina have reported severe Vibrio vulnifax infection, most caused by wound infection. This is a list of multi-state Vibrio infection investigated by CDC since 2006. All of those outbreaks occurs during summer. Due to time constraint, we cannot discuss them further here today, but you may Google them to find more detailed information later. Who is more likely to get vibriosis? Actually, anyone. Anyone can get sick from vibriosis, but people with compromised immune system are more likely to get sick. For example, people with diabetes, cancer, chronic liver, and kidney disease and AIDS, and those who have other illness or under medication and medical treatment. All those people have higher risk to get vibriosis. How to prevent? We mentioned Vibrio vulnifax primarily infect people through open wound contact with seawater or brackish water. Therefore, if you have a wound or cut, stay out of the seawater or brackish water. People who are at higher risk also should be cautious when they go into coastal water and handling raw and undercooked shellfish. For preventing foodborne vibriosis, shellfish industry play a critical role. They need to follow the National Shellfish Sanitation Program. It's called NSSP. They provide a guide for the control of mollusk and shellfish. The guidance is more than 500 pages. We provide a one-day certification training to marine and oyster shippers and dealers to assist them to implement the NSSP program. So I will leave this to Valerie for a more detailed talk later. In addition, seafood buyers, restaurants, consumer, everybody who should follow preventive procedures to safely handle oyster and other seafood. If you are an immune-compromised individual, do not eat raw or undercooked oyster. Clean, separate, cook, and chill are 4 basic steps for food safety. Barry and Molly will talk those more detail later. I'll just provide the outline how to prevent from wound infection and also from eating raw and undercooked shellfish. For further reading, there are some good education material created by CDC. You can access the online information using the link or scan the code provided here. Although we do not have a chance to discuss the post-harvest process for Vibrio control, here is a list of publication for your future reference. If you have any question about my talk today and any other question related to seafood safety, processing, handling, you are welcome to contact me through email and the telephone provided here. This is all for my presentation. Thank you everyone for your attention. If you have a chance, please scan this code to provide your feedback on my talk. Your comment and suggestion are greatly appreciated. If you have question, please save the question until all of our speakers finish our talk. Thank you again.
Thanks, Cathy. Yep, and if you have questions you want to get out now, you can put them in the chat. We'll address them at the end, but I'll pass the screen now to Valerie.
Good afternoon, everyone. I'll be speaking today on the role the state shellfish sanitation programs play in preventing shellfish-borne illnesses. Is that advancing? Okay. So the National Shellfish Sanitation Program is a cooperative state and federal program for the sanitary control of bivalve molluscan shellfish produced and sold for human consumption. The national program began in 1925 after widespread typhoid fever outbreaks, which were eventually traced back to sewage-polluted oysters. As part of the National Shellfish Sanitation Program, state agencies with our federal partners and industry representatives work together to create uniform guidelines for all state and international programs as part of the NSSP for the sanitary control of shellfish that are moved through interstate commerce. The U.S. Food and Drug Administration has the overall authority to evaluate state compliance with the National Shellfish Sanitation Program. When I mention bivalve molluscan shellfish, I specifically mean oysters, clams, and mussels that are filter-feeding organisms. You may also think of scallops, but scallops are usually exempt from the national regulations because the final product is usually just the adductor muscle of the organism. However, if scallops are whole and still row on, then they would fall under the same guidelines as shown here. As filter feeders, these organisms can filter up to 50 gallons of water a day, and as they do so, they can concentrate pathogens and toxins in the water up to 100 times the concentrations that are the ambient levels in the water. This, combined with the fact that shellfish are commonly eaten raw or undercooked, alive and whole, means that anything that these shellfish have taken into their bodies, you'll be taking it into your body when you ingest them. So one of the main purposes of the Shellfish Sanitation Program is to make sure that the waters that these shellfish are harvested from are going to meet the requirements so that those shellfish are safe for human consumption. We use sanitary survey reports to evaluate several environmental factors to determine whether our growing areas are safe for shellfish harvest. We look at bacteriological water quality. We do a complete shoreline survey of potential pollution sources in the watershed. We do hydrographic surveys of point source discharges, such as wastewater treatment plant outfalls. A meteorological survey is looking at rainfall and the potential stormwater runoff that results from that. This is all compiled into a sanitary survey report where we evaluate all of these factors according to the NSSP guidelines, and then we make our water quality classifications of the shellfish growing areas. In North Carolina, our bacteriological sampling consists of 1,000 stations coastwide that are sampled randomly a minimum of 6 times a year. All of the samples we collect in North Carolina are analyzed in one of our 3 FDA certified laboratory facilities. They're planted, cultured, and analyzed by our personnel. And we use fecal coliform bacteria as our indicator organism. This is the test that we use that's approved by the FDA. It indicates potential presence of pathogens that could be harmful to humans. We use these sample results to classify shellfish growing areas and to reopen areas that we've temporarily closed to shellfish harvest. I would like to point out that for our bacteriological sampling, when we do our water quality analysis, we're looking at fecal coliform indicator bacteria. Vibrio bacteria, as Dr. Liu mentioned, is naturally occurring and not related to pollution. So when we do our water quality sampling, it doesn't indicate the presence or the prevalence of Vibrio bacteria in the waters that we're testing. So once shellfish are harvested and from the approved shellfish growing waters, they must be delivered to a certified shellfish dealer. The inspections and certification program inspects and certifies shellfish dealers and processing plants according to NSSP guidelines. Our inspections are based on HACCP principles, looking at the potential risks associated with critical control points such as receiving, product storage, time and temperature out of refrigeration for processing activities, and product labeling. The sanitation items we're looking at are considering the fact that adulteration and cross-contamination can occur if conditions are sanitary or unprotected, and that bacteria can grow quickly if improperly stored. Once a dealer facility meets the NSSP requirements and we certify them, they're added to the FDA Interstate Certified Shellfish Shippers List. Any firm that has been approved for moving shellfish in interstate commerce will be on this list. All of our domestic certified shippers are on this list, and there's actually another section for our foreign certified shippers. I would like to point out, at least in the state of North Carolina, we have other certified dealers that are certified to move shellfish within the state of North Carolina, but they may not necessarily be on the list to ship state shellfish interstate. So it's always best to check with your own state control authority when you're thinking of sourcing new potential suppliers of your shellfish product, because they may have other options available to you. So just drawing back to the fact that Vibrio are naturally occurring in the environment and not related to pollution, we have to take a little bit of a different approach to evaluating risk. So another part of the National Shellfish Sanitation Program is the Risk Assessment and Risk Management Program. And specifically for Vibrio, all states are required to conduct risk evaluation for Vibrio vulnificus and Vibrio parahemolyticus annually. The risk evaluation is based on factors such as the number of illnesses that have been confirmed that have occurred in the state previously, and to the volume of harvest that is occurring in that state annually. A control plan may be required if certain triggers are met. Certain states will use either water temperature, air temperature, or salinity as their trigger for when they need to implement a Vibrio control plan. If you're under a Vibrio control plan, there's certain measures that you can put into place to reduce the risk of Vibrio illness. The most common control measure that states use is limiting the time from harvest to refrigeration. There are other options that are available, like Dr. Liu mentioned, post-harvest processing, such as high pressure treatment or quick freezing. Refer back to her slides for several studies on potential post-harvest processing activities. Another option that is not used that often is restricted use shell stock, which are labeled specifically for shucking by a certified dealer only, with the thinking being that shucked product that is delivered to restaurants is thoroughly cooked before it's served to the public and not being served raw. Using North Carolina as an example, we are under a VP control plan, and looking at air temperature, water temperature, and salinity. We have determined May 1st to October 14th to be the time period that our dealers fall under the Vibrio control plan. We also use time and temperature control. So there's a maximum of 5 hours from harvest to refrigeration during this time period. And all certified dealers must get oysters cooled to 50 degrees within 10 hours or less. Once the oysters are cooled to 50 degrees, they must be placed into refrigeration and maintained at 45 throughout the distribution and transportation network. So due to the Vibrio growth curves of Vibrio bacteria, we know that Vibrio parahemolyticus grows rapidly over 50 degrees and VV grows rapidly over 55. So temperature control is important. Once it goes under temperature control at a dealer facility, it needs to be maintained under temperature control until it's delivered to the final consumer. All shellfish must be shipped by certified dealers under either adequately iced or under mechanical refrigeration in a pre-chilled conveyance of 45 degrees or less. North Carolina is a little bit unique in that we don't allow icing as our refrigeration method. We only allow mechanical refrigeration. But it's just important to know that when you are receiving product as say a food service industry, a restaurant or a seafood market, you should be receiving it under some type of temperature control, whether it's refrigerated or adequately iced. Just some final thoughts for the food service industry. These are some items that we take into account when we're evaluating our certified dealers, but they definitely apply to other food service industries as well. I've already mentioned, the receiving temperature, make sure that you're receiving product that's adequately cooled. Another important factor is maintaining shelf stock identification. Tagging requirements are in place for certified dealers, but those tags should be remain in contact with the container that the shelf stock is in until those shelf stock are completely sold to the consumer or served in the restaurant. Those shelf stock tags should be maintained for a minimum of 90 days for illness traceback purposes, which Molly will get into later. I would also like to point out that the consumer advisory that's required by Food Code is your last step for risk avoidance as far as educating the public, just so they have one more chance to learn what their risks are before they decide what to order off the menu. I believe that's all I had. So like Cindy said, Dr. Lewis said, we'll be holding all questions until the end.
Great. Thank you, Valerie. Yep, you feel free to put them in the chat or hold till the end, and I'll pass the screen now to Barry to talk about handling and preparing.
Great. Well, as Valerie mentioned, the danger of shellfish, eating them raw or undercooked, is that there could be the potential for a highly concentrated number of dangerous organisms in the GI tract. And as Dr. Liu indicated, anybody can get sick from vibriosis, but those who are immunocompromised are most at risk for coming down with a serious illness. So my presentation is basically geared toward the retail consumer. It's not advancing for whatever reasons.
Barry, make sure you have the PowerPoint clicked on.
Yeah, I thought I did. Okay, there it goes. What we recommend to people who are interested in buying shellfish is to go to a brick and mortar establishment because they are probably in the HACCP system, specifically a seafood market or a grocery store. But if somebody is going to buy locally from a shellfish grower, we do recommend that they contact their state's Shellfish Sanitation branch to learn if that supplier is certified to distribute shellfish. When it comes to the quality characteristics of live shellfish, we recommend people look for tightly closed shells. If they are open, they shut when they're lightly tapped. Avoid any clams or oysters whose shells do not shut when tapped. Look for moist intact shells and avoid those that are cracked, chipped, or appear very dry. And also avoid shellfish that have a strong fishy odor. They should have really a mild scent. For shucked oysters, look for plump, cream-colored meat. Anything that's shriveled or dry or dark in appearance should be avoided. Anything that has shell particulates or sand should be avoided. The liquid should be clear or slightly opaque. Anything very cloudy might indicate some bacterial growth, and you should stay away from that. When it comes to transporting live shellfish from a retail outlet to home, there are a number of ways that can be done. We provide this as a possibility for people who are interested in looking at this. We recommend putting about 3 to 4 inches of ice at the bottom of a cooler, and then cover that ice with cardboard or with some kind of waxed or plastic foam, which has holes punched in it, and then place the shellfish on the cardboard or the foam, and then cover that with clean damp towels or several layers of damp cheesecloth. The purpose of doing this is to make sure that the shellfish are kept cold, but that they do not come in contact with any melting ice, which might cold shock them and kill them. When it comes to storing shellfish, as Valerie's mentioned, live shellfish can remain viable for several days if they are kept at 45 degrees max or below. Again, if there are any shells that do not close when lightly tapped when you take them out of the cooler, we recommend you not use them. And then when it comes to cooking live shellfish, the FDA says that the internal temperature of 145 degrees for 15 minutes is adequate to destroy most organisms. But sometimes people don't have access to a thermometer to check the temperature of their shellfish. So the CDC and the FDA recommend when you're cooking shellfish is to boil it until they open and then continue boiling for another 3 to 5 minutes. If people are going to steam them, then make sure that the shellfish are added to a steamer that's already steaming and cook anywhere from 4 to 9 minutes. And again, if any shellfish have failed to open during the cook process, discard them. When it comes to shucked oysters, look for an opaque appearance after cooking. The meat, the edges of that meat should be slightly curled after cooking. CDC and the FDA again recommend that you boil for at least 3 minutes. If you're going to fry those oysters, the temperature of the oil should be 375 degrees Fahrenheit, and the cook time should be a minimum of 3 minutes. Baking should be at 450 degrees Fahrenheit for about 10 minutes. And then here I've provided some additional resources for people to look at more detail that goes into more explanations about cross-contamination and how to properly handle oysters in a home setting. And with that, I will pass it on to Molly.
Thanks, Barry. And Molly.
That up. So you can hear me?
Yes.
I'm going to be speaking to everyone about the public health response when there's a foodborne illness investigation. This particular one is Vibrio. And I would like to point out that different states have different levels of regulatory authority. So what I'm speaking of is what happens in North Carolina. Here we go. Having the same problem that Barry is having.
And make sure you click on the PowerPoint, because if you change to Zoom to share it, it won't be selected.
Sharing. I'm sorry, where is that at? Because I'm not seeing it.
That's right. You changed it. You went a couple slides forward.
Oh, sorry. So referring back to Cathy's slides at the beginning of the presentation, where she was talking about statistics, my portion of the presentation is designed to give you a little more insight as to how a sick person becomes a statistic in the first place. And that is through foodborne illness reporting and investigation. It all starts with a sick person who seeks medical aid, and they go to the doctor. The doctor suspects a organism causing the distress. They test, they confirm Vibrio, and the information sharing begins. No, it's not doing it again. Sorry, I'm having technical difficulties. So we're going to start with the basics. As I said, Vibrio is a reportable disease, which means positive results are shared with multiple entities, from the local authorities to the state health department, all the way up to the CDC. And once we get word that there is a Vibrio illness or multiple illnesses, we start sharing the information, and we start asking the basic questions: who, when, what, and where, or what we're trying to find the answers to, figure out how that illness happened in the first place. We have to figure these things out to stop the spread. And when I say we, it is definitely a team effort. So who is the team? What we refer to it in North Carolina as the EPI team. It's a constant core members, including health department, administration, folks from the clinic, and environmental health personnel. We meet regularly, whether there's an investigation going on or not, with local medical professionals, especially folks from our hospital. In this situation where there's a Vibrio investigation, Shellfish Sanitation would be involved as part of the EPI team. And we may be calling folks from the state health department to help out, depending on how big the investigation gets. So when does all of this start? Any member of the EPI team may be the first to become aware of Vibrio-related illness. Whoever that may be in Carteret County, they're the ones who start making phone calls to the other folks who would need to be aware. Those same folks that were listed on the last slide. Usually it's the health department's communicable disease or CD nurse that is kind of the central person to the whole communication and investigation. But everything in the next few slides happens simultaneously, and it's happening quickly. This is an ongoing event, and we don't stop until we're satisfied that it's over. And reasonable precautions have been put in place to prevent anybody else from getting sick. So the information is organized by this paper that is on the screen. It's called a COVIS form, the cholera and other Vibrio illness notification. Each patient who tests positive for Vibrio gets one of these forms filled out. This form is started, it's a 6-page form. The first several pages have to do with the patient's specific demographics, lab information. There's going to be a food history done. Vibrio symptoms can take anywhere from 16 hours up to 7 days to present. So we have to go back and talk to people about what they were eating the week prior. Most folks believe that it was the last thing that they ate that caused them to get sick, and that is not necessarily true. The last couple of pages are more environmental related. Environmental health has a page that we have to fill out if a restaurant or other food service establishment is implicated in the outbreak or the illness. Shellfish Sanitation also has a page on if it's trace tobacco or suspected that it might be shellfish related. They will visit establishments that were implicated and do the tag trace back, which is one of the reasons we require a 90-day hold time on shelf stock tags after they're served, so that we can do trace back and try to figure out where the source of the Vibrio was. Another step that the EPI team takes is creating a case definition. The COVIS form helps us narrow down where we should start looking for the source, and so does a case definition. If we get 10 COVIS forms or 10 different patients who have tested for Vibrio, we're going to be looking at those 10 forms or talking to the patients individually and trying to figure out, do they have common exposures? Were they exposed in common locations? Do they have common symptoms and time frames? We're also going to be making sure that the lab results, the Vibrio strains test, or show the same on the lab results. Those are some ways that we kind of start pinpointing and narrowing in how to find the source of the illness. So if a food service establishment is implicated, environmental health is going to visit. We're going to talk to them about, and we're going to be observing as we discuss. We're going to be talking to them about how they're storing their shellfish. Is it cold enough? Is it protected? Are you keeping your tags the way that you're supposed to be keeping them? Do you have employee health policies in place that exclude sick people? Do you have a vomit and diarrhea cleanup procedure in place so that if somebody does get sick in your establishment, you know that you clean it and sanitize it thoroughly to prevent more people from getting sick and being exposed? And Shellfish Sanitation is going to do similar investigations in the establishments that they visit. Sometimes it's the restaurant, the same restaurant that we're in, but they also use those tags to do trace backs to the source waters where the shellfish were harvested to begin with. And then they can go back and look at all of the things that Valerie was referring to, the rain events and point source and non-point source pollution. So again, all of this is going on at the same time. The clinic, usually our CD nurse is keeping in contact with the patients, with the medical care providers. There's going to be communication out to the community. If you ate here, if you have these symptoms, please seek medical care. We're going to be letting urgent care in the hospital, especially the ER, know if somebody presents with these symptoms, test them for Vibrio to see if they might be carrying that bacteria and might be part of the investigation. Depending on what seems to be causing the problem, the information may be sent to the media. There may be public service announcements. I have seen in foodborne illness investigations where a restaurant was implicated and lots of people, we're a tourist area, people come visit, they eat, they may not get sick until they get home. And we need those people to know that there's, they could be part of an illness as well. So it might go out in newspapers from Carteret County. It could go all up and down the Eastern Seaboard, the New York Times, the Washington Post. There's not a protection necessarily when it comes to this level of public health response. And Shellfish Sanitation may be sending out similar PSAs about staying out of this body of water, or putting their signs up saying, don't take harvest shellfish from this particular area for the time being, until we figure out, until we know that the outbreak has stopped. So again, if a food service establishment seems to be involved and they seem to be having problems, we may ask for voluntary closure until certain things are rectified. We have the authority to shut the restaurant down temporarily until we're satisfied. If it comes to that, Shellfish Sanitation may temporarily close harvesting waters. We may never know exactly what happened or where the breakdown was, but we try very hard to determine that so that we can make sure that it stops, nobody else gets sick, and that cycle that I've referred to, the interviews, the visits, the meetings, keeps going as new information gets pulled in until, again, we know that the outbreak has stopped. The one thing that sets Vibrio apart is that it is reportable, so there are a lot of different entities involved. And I believe that is my last slide. I apologize for the technical difficulties, but I assume now we will open it up to questions from the participants.
Great. Thank you, Molly. And thanks again, everybody, Valerie, Cathy, Barry, Molly. We will open it up for questions. Again, you can put it in the chat box if you would like to raise your hand. Daphne can unmute you if you'd prefer to ask it. I see there was one question in the chat already, but Cathy answered it. So Anna Maria, if that didn't answer your question, please let us know. We can clarify some more. Any questions? Was that a hand raise? All right. Steve Otwell. Daphne, can you unmute Steve?
Can you hear me, Mike?
Yep.
My question about the Vibrio, particularly the vulnificus, the reasonably likely that this will occur. You've mentioned warm months, warm waters, and we typically see this being involved in the Gulf of Mexico. But with the recent trends in warming and what have you, is it reasonably likely that Vibrio vulnificus will occur, say, from the Chesapeake Bay of some of the more eastern regions, and do we monitor it for that reason?
I guess this question is a very good question. Thank you, Steve, for the wonderful question. Yeah, I think it may happen. It depends. We all know the heat waves across the coast area. But what we can do is, I mean, actually the NOAA, they have the Vibrio parahermeneutics forecast, and also they are also developing Vibrio vulnificus forecast, and also FDA has a risk calculator. But still, there are still a lot of work or research need to be done. But definitely, it may happen.
So you're saying it may happen from waters along the eastern seaboard?
Yeah, it depends the temperature, the salinity, the nature. Yeah, I think maybe, but if we can do more research has been done, then and more education, especially education is very important, such as today the Vibrio webinar. Education, if the vulnificus most case is caused by wound infection, so educate people. If you have a wound or cut, just you need to stay away from marine water, any salt water or brackish water. And that is the very strict, simple way, but sometimes it's mostly effective. That education is also very important.
Anybody want to add anything? We've got a couple more questions.
I would just like to add really quick that Vibrio, we already do know that Vibrio is present in the eastern seaboard waters. But I would also like to point out that there's a lot of other naturally occurring organisms that can cause wound infections. So I think it's important for everybody to just practice some safe wound care if you're in the marine environment regularly.
Great. All right, we're going to take one of the chat ones and then we'll do Zach. So first from Aiden, how do you all feel about ice slurries as a post-harvest practice?
I can answer that.
Yeah, okay. Go, you can go ahead.
Well, I was just going to say that we would not allow a food service establishment to do that. If you put multiple oysters into an ice slurry, there's a chance that they could purge. And if one of those oysters is contaminated and they purge, then there is a possibility that all of them become contaminated. And kind of potentially contaminating the whole bunch. And that's not a good idea.
Cathy, did you have something?
I would add the ice slurry, maybe used in some states as like a quick chilling the oyster after the harvest, and ice slurry is actually more efficient than ice itself and more efficient than mechanical refrigeration right after harvest. Even though you have boats with refrigeration equipment, sometimes during summer, when the oyster harvest get to the internal temperature below 50, may still take some time, and also depends the volume of your harvest and your capacity of the refrigeration, equipment. So I think it depends. The baseline is if that works and that is okay, but consider as some other risk. It's just when the oyster in ice slurry, I don't think they will actively pump, and if they don't pump, the Vibrio is inside. So I think that type of risk is not very high. Just in my opinion, but I may not be right. So
Okay. Barry or Valerie, do you have anything to add on slurries?
I know that we had looked at it a little bit with using a slurry to make like an icing mist several years ago, but that isn't permitted yet with North Carolina regulations. I would just refer people to their specific state authority, because there may be a way to have it as a validated process for chilling oysters quickly, depending on what state you're in.
Okay. All right. And we were meant to be a 45-minute webinar. If our speakers are okay with continuing, we do have a couple more questions, but if not, we can follow up with those. But we'll jump to Zach real quick to get his, since it's hand raised. If you want to unmute Zach. There we go.
Can you hear me?
You're quiet, but yes.
Is that any better?
A little bit.
Okay, well, I'll talk loud. Just,
Good.
I can make a comment on the slurries. In Connecticut here, we do allow ice slurries, and farmers I've talked to just want to make sure that that isn't too cold, so you don't want to cold shock the animals, because then you can kill them pretty easily. So just honing in on that right temperature is important. My question was about the distinction of like Vibrio vulnificus versus Vibrio P when doing these investigations. In Connecticut, we had a couple infections of Vibrio vulnificus from wound infections, and it got conflated with getting that from eating oysters, and it caused a big major impact to the industry here, and there was a lot of people that were upset. So like, I guess my question is just like, how are these different ones approached differently when notifying the public? Are they, or is it kind of the same kind of talking points that you release?
I would say that, as far as the COVIS form that we get, we just, if it has it broken down to species, it doesn't really alter the traceback investigation that we're doing. I think you're referring to like, how do we communicate with the public if there's an illness?
Yes. Yeah.
Yeah. I know that was a big problem in North Carolina last year as well, because we had some wound infection illnesses. And I think the information that the public health department put out was very accurate. The issue sometimes is, when the general media gets access to it, the first thing that comes up when you Google, Vibrio is raw oysters. And so it seems like it always gets associated whether or not that specific illness was ever tied to consumption or not. It's something that we're constantly working on when, you know, when we're doing our communications, and, you know, educational opportunities like this only help, I think.
Great. All right, so some of these questions I can always follow up with folks on. I don't know if anybody knows the state with the highest oyster percent of illnesses at the moment. And the other one was how to access public records via CDC and documents on Vibrio occurrences and illnesses, specifically to target or identify product source or site. Anybody have any thoughts? While you're thinking, I can quickly touch on the depuration one. There is guidance in the NSSP. If done properly in non-contaminated waters, depuration can remove Vibrio.
Yeah, and also I would like to add on the list I provided, there are some publication to particular focus on. We don't call it, I mean, ISSA or FDA doesn't like us to call it depuration. It's now it calls wet storage. Depuration is target on water quality organism like coliform, E. coli, that type. For Vibrio, is not related to water quality. So depuration is the water quality is an issue. Then they use depuration to decrease the coliform, fecal coliform and coliform bacteria. So that's is the wet storage. Yes, they can be done properly and actually can remove the Vibrio parahelmintics to the undetectable level from like into the fifth.
Great. Thanks, Cathy. Thanks. I apologize.
There were some questions about how to access data. I think that someone put some links in there for CDC information.
Apologies.
Cathy or Molly, do you know the common incubation times, incubation periods for vibriosis? Is there a
I
common?
was looking online and it looks like it's anywhere from 12 to 72 hours, depending on the person's health. But I also heard Molly say it could take a couple of days, so I'm not.
Well, then also add in the time period before they seek medical attention as well. You know, they may be sick a day or two before they reach out.
Great. Well, I apologize, everybody. I got kicked off. I can't see the chat anymore, but I think we got through all the questions, it sounds like, correct?
Looks like it.
I'm scrolling through. I think that we touched on them all.
It's
All
frozen
right.
now.
Well, thank you, everybody, for participating today. If you have additional questions, you can send them to me or any of the panelists who shared their contact information. And keep a lookout. We'll have another community engagement webinar scheduled for the fall, looking at a variety of resources relevant to our seafood community and especially our seafood HACCP trainers. Thanks again to our speakers, Molly, Barry, Valerie, and Dr. Cathy Liu. And we hope to see you all again.
Thank you.
Thank you.
Thanks. Have a great day, everyone.
Bye.